Cognitive enhancer. Smart drug. The study drug. One pill from your friend with ADHD and you can have it all. Focus on your test for hours without issue. Study all night to retain necessary information. Improve your memory to get an A. Party harder after you pass your test with flying colors. All of this bundled into one little prescription drug. Okay, you've got our attention. But what exactly is Adderall? Adderall is a prescription medication that contains two drugs, amphetamine and dextroamphetamine. It belongs to a class of medications called psychostimulants. It's most commonly used to treat attention deficit hyperactivity disorder, or ADHD. It can also be used to treat narcolepsy. Adderall is considered a first-choice treatment for ADHD. Studies show that it improves attention and focus and reduces impulsive behaviors. So how does it work? Your central nervous system is the hub of your body's processing. It's made up of the brain and the spinal cord. Adderall is considered a CNS stimulant. Stimulants such as cocaine, methamphetamine affect the transporters in the brain to increase the level of neurotransmitters, causing the receptors in your brain to constantly fire. One key transmitter often deficient in individuals with ADHD is norepinephrine, along with dopa and dopamine. In theory, the primary stimulant medications used to treat ADHD stimulate specific cells within the brain to produce more of this deficient neurotransmitter. That's why these medications are called stimulants, though it's unknown exactly how they work to relieve ADHD symptoms. Adderall is a sympathomimetic drug, which means that it functions by mimicking the neurotransmitters dopamine, norepinephrine, and adrenaline. Norepinephrine has a longer retention time in the synapses and thus enhances stimulation. Adrenaline brings alertness, clarity, and focus by creating a fight-or-flight response in your sympathetic nervous system. Finally, the sense of euphoria is generated by dopamine. By inhibiting the dopamine transporters, the dopamine neurotransmitter levels are increased within the synaptic cleft of your cells. The synaptic cleft is the location of the receptors which creates action potential in the brain. This causes the sensation of stimulation, which increases the abuse potential. With drug addiction, triggers are real. They create an anticipation of the drug and are generated by environmental conditioned cues. Sounds ridiculous, right? We're not dogs. It turns out that the brain will actually respond to your craving. With Adderall, this can create a placebo effect on your brain. In a 2012 study, subjects who were told they were going to receive the drug, but did not receive it, showed signs of both the feeling of being high and increased focus. Their brains responded with no drug in their system. There's a difference between activation and neurocognition. Neurocognition is what students believe they are enhancing, when in fact, all it activates is positive emotions and subjective drug responses. The cognitive enhancing facts of Adderall are essentially an illusion in non-ADHD recipients. For those without ADHD, Adderall does not enhance your cognition. Only you hold the power to focus. Your brain is specially evolved for complex thought and needs no intervention. Almost all ADHD medications are prescribed orally, which is the safest way due to how the body processes chemicals. Your body regulates the uptake of the drug in a process known as first-pass metabolism. Other prescription administration methods may include oral or liquid transdermal patch. Many ADHD medications have an extended or slow-release mechanism which allows it to be absorbed by the body over a longer period of time, allowing its effects to be felt for longer and preventing the need for additional dosing. The safest way to take this drug? It's simple. Adderall is a widely prescribed medication. Speak to your doctor about the possibility of an ADHD diagnosis and prescription. They'll help you determine the best possible dosage and administration for your body. So what's the riskiest way to take this drug? What's the fastest? Snorting, smoking, or IV injecting Adderall creates the highest potential for addiction and overdose. Once Adderall reaches the brain, it affects the neurotransmitters norepinephrine and dopamine, which are responsible for euphoria and other psychological effects. When snorted, these effects are amplified in a way that is the chemical equivalent to meth usage. Extreme euphoria, elevated heart rate, appetite loss, and sleep loss can occur. This can lead to psychotic issues with continued abuse. Due to the delayed release aspect of intermediate and long-acting ADHD drugs, they're particularly unsuitable for snorting or IV injection of crush tablets. Because if you snort or inject them, they're no longer slow release, and higher doses of these extended release drugs that are snorted or injected can lead to overdose. Through this study, we see that Adderall impairs performance on memory. This chart shows the negative impacts on neurocognitive tasks performed by healthy college students. In addition, not just memory but reaction time are also being negatively impacted. As it turns out, this may not be a smart drug after all. Health risks include heart attack, stroke, sexual dysfunction, psychosis, panic attacks, and many other side effects. Adderall has long-term effects on multiple organs. It can weaken or damage the cardiovascular system, which leads to complicated heart and lung conditions. It may result in sudden cardiac death, trouble breathing, and other pulmonary diseases. It also slows down muscles in our digestive tract that may cause constipation, abdominal pain, and other GI tract issues. When it comes to the brain, studies have shown that Adderall can be tied to mental health issues. It may also lead to mood swings or symptoms of psychosis. The most important long-term effect is increasing the risk of aggression and suicidal thoughts. Over time, it impacts the brain's reward center, so the ability to experience pleasure is decreased. This can further lead to dependence on the drug. When it comes to social risk, the side effects kind of snowball. You can feel tired or mentally foggy, lose trust in yourself and your friends and family, lie about your Adderall use to them, lose interest in social activities, it snowballs into getting poor grades, possibly stealing money for pills, stealing prescriptions. It's just a cascade effect. But wait, there's more. Other long-term effects could include difficulty in getting an erection due to the restriction of blood flow. Researchers also found that in use with children and young adults can lead to a slowage in normal growth rates. Sometimes if the transdermal system is used, skin discoloration may occur. So, now we've seen that Adderall overdose is a real risk for those who abuse the recommended dosage or those that may snort, smoke, or inject it. How do you know if you or someone you know may be having an Adderall overdose? Someone with an Adderall overdose may exhibit these symptoms: increased body temperature, seizures, hallucinating, rapid heart rate, nausea, vomiting, agitation, dilated pupils, and more. So what do you do when someone's experiencing all of these symptoms and may be having an Adderall overdose? Make sure the person is kept cool in cases where they may be experiencing overheating or hyperthermia. Call 911 or go to the ER. Doctors may give medication for sedation, activated charcoal, or other cardiac medications if necessary. So at the end of all this, we see that this so-called smart drug doesn't have any effect on complex memory, might not have any results on working memory, and has the potential to cause cardiomyopathy. Not only that, it degrades your problem-solving skills and it could induce psychosis in predisposed individuals. Turns out, taking Adderall without having ADHD isn't such a smart move, and maybe it really isn't such a smart drug after all.